Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
As we get older, our bodies go through a series of changes, and one of the most overlooked and least discussed, but probably one of the most important, is vitamin deficiencies. Now, you think, or you might think, that this just comes with the territory. You're aging, a lot of things are changing, and some things are declining, and maybe you think vitamin stores in your body are one of those things that are declining. But what if I told you that some of the common problems that we face as we age, such as fatigue, muscle weakness, even memory loss, could actually be linked to deficiencies in certain vitamins in our system? Today, we're going to talk about what the most common vitamin deficiencies are as you age, what supplements you should be taking, as well as answer your healthcare-related questions here on Ask the Doc. Welcome to Ask the Doc, the show where we encourage you, our viewers, to send in your healthcare-related questions. I'm Dr. Kamaljit Kaur, a double board-certified concierge primary care doctor here in beautiful Coral Springs, South Florida. Today's first question comes to us from Diego, who just reached out to us through our website, allhealthtv.com. Diego's question is, Hola, Doc. Hola, Diego. My Aunt Louisa fell last week and broke her arm. Oh, I'm so sorry to hear. I rushed her to the hospital where they took some x-rays, put a cast on her, and gave her some pain meds and a prescription for vitamin D. I get the pain meds, but what's up with this special vitamin D? Hi, Diego. Thank you for sending in this question. It's really important, and I hope your aunt is doing better. Based on what you told us, I think it's safe to say that your Aunt Louisa may have osteoporosis. Now, let me explain a little bit more about that. As we age, we begin to lose muscle mass and bone mass unless we've done something to be proactive about it and prevent it, like exercise or take certain supplements. If enough of the bone density is lost, then it turns into a condition called osteoporosis. So imagine your bone is this thick, white substance, right? And then because of losing minerals and vitamins or even strength over years as we age, it begins to form pores or little holes in that bone mass. And then that is the condition called osteoporosis. Now, it's a very simplified explanation for what it is. But basically, this leads to an increased risk of bone fractures. And obviously, that can be very detrimental to anybody's health. Now, did you know that it's estimated that 1.3 million fractures in the U.S. per year have actually been attributed to osteoporosis? So as you can see, this is very important to prevent and to treat if you already have it. Now, many of us know that calcium is important in bone health. I'm sure we've heard of it, from a young age. Drink your milk, take your vitamins. You need enough calcium to grow strong and healthy. But did you know that vitamin D is just as important? Now, calcium may be the main bone builder, but vitamin D is its trusty little sidekick because it helps to break down the calcium so it's better absorbed by your body. Now, vitamin D also has many actions and benefits for your body, even aside from bone health, like improving your muscular health, some benefit in reducing some cancer risk. And I should say that that's only been shown by some studies, so it's not a generally validated statement, but some studies have shown lower risk of cancers with vitamin D being in adequate levels. And maintaining a healthy immune system. Vitamin D has its hand in a lot of parts of your immune system. So when you're low, you might feel the effects of a imbalanced or inadequate immune system. So now that being said, we do prefer that you get your vitamin D through natural sources like the sun and certain foods. But that's not always possible. For instance, your physician is never going to tell you to sit out in the sun for as long as it actually would take to get enough vitamin D, because then you're also exposing yourself to a risk of skin cancer. And obviously, we don't want to do that. And then food. Now, of course, there's lots of foods that either naturally have vitamin D or that are fortified with vitamin D. And we encourage consumption of all these foods. But let's get real. It's very difficult to have a well-balanced diet. And I know we all try our best to do it, but sometimes it's just not possible for so many reasons. So that being said, it's not unusual to give vitamin D in supplementation form. Now, this is also why we recommend that you talk to your doctor about your vitamin and mineral levels and see what is best for you, what you might be lacking, and what you should be taking as far as supplements go. Now, let's get to our next question. This comes to us from Alicia, and Alicia reached out to us through YouTube. She asks, "Hi, Dr. Kaur. My mother went to see her physician last week because she was feeling tired all the time and thought she was looking too pale. I thought it might be heart related, but the doc said she was anemic and needed to eat some iron-rich foods and take some vitamin C. And oh yeah, he told me to stop taking Aleve and antacids. Why would he do that?" Hi, Alicia. Thank you for writing in. I have a pretty good idea of why her doctor might have said to stop medications like NSAIDs, such as ibuprofen, Aleve, and the antacids as well. Unfortunately, these agents make it harder for your body to absorb a lot of nutrients and vitamins like iron, calcium, vitamin C. So for a variety of reasons, it may be more difficult for your body to get these nutrients, especially as we age. But if on top of that, you're taking ibuprofen or Aleve on a regular basis or taking antacids on a regular basis, you're introducing certain chemicals into your digestive system that are going to cause inflammation, maybe even erode the lining of your digestive system. And then that's going to make it more difficult for your body to take in those nutrients and do the good things with them that they're supposed to do. For instance, majority of your iron is absorbed in your small intestine. And if you're taking Aleve, ibuprofen on a regular basis or medications from that family, they cause inflammation in those parts of your intestine. And anytime something is inflamed, it's not working at its best capacity, right? So that's going to be harder for it to do the things and function the way it should function. Now, it's also true that these medications are anti-inflammatories. So I know a lot of you might be thinking, well, this is contradictory. Yeah, I know it is. Now, yes, NSAIDs are anti-inflammatories, but that doesn't negate the fact that they do also cause some inflammation in your digestive system. So you need to take them very carefully and under the advice of your physician. Now, similarly, antacids can also change the structure of the lining of your stomach and your intestines and your digestive system in general. Now, if you are taking antacids on a regular basis, this leads to an even profound effect, and it's going to make it difficult for your body to absorb all those nutrients. But something else that's important to know is that antacids can actually bind iron. So if the antacid grabs that iron, either through what you're getting through your food or what you're getting through supplements, if the antacids take it and bind it, it's not available for your body to use it. So you might be taking iron tablets and then you're taking medications like Prilosec or Tums, and you're finding that, well, why isn't my iron level going up? What's going on? Well, it's because basically nothing's really happening to it. So as always, talk to your doctor, make sure that you're all on the same page and understanding what is best for you to take, how to take it, and when to take it, because that's also very, very important. Now we have another question from our website, allhealthtv.com. And it looks like we're about to change lanes for a minute here. The next question is from our viewer, Linda. And Linda asks, Dr. Kaur, lately I've been experiencing severe eczema on my face and body. As if this wasn't bad enough, I'm getting frequent UTIs. I've been working with a functional medicine physician who said I needed to exercise, put me on a restrictive diet for 4 months, and ordered blood tests which revealed E. coli in my system. So far, nothing has changed. Is there a light at the end of this tunnel? Hi, Linda. Thank you for writing in. And I'm so sorry that you're experiencing this. I know it is so frustrating when you have a symptom, no matter what that symptom is, and you just can't find an answer or a solution for it. So hopefully you soon do. But I really want to talk a little bit about what you're getting tested and what's going on as far as functional medicine goes. In the last several years, Western medicine has really come to appreciate and learn about the inner workings of the body and how holistic we need to be when it comes to diagnosing, assessing, and treating our patients. And in that light, functional medicine has come about. That being said, though I cannot provide a specific answer because I don't know your exact results and your exact clinical course, I can suggest that addressing the situation with your functional medicine physician and asking questions like, the recommendations that you're making, how are they supposed to help? In what way is this working to help me alleviate my symptoms or to come to a solution? And then also, where was the E. coli found in your system? Was it found through a blood test? Was it found through a urine test? Now, E. coli can commonly be found in certain parts of the body, not in large amounts and not something that we see regularly, but in certain situations, we do come to see it commonly. So you really want to get those specifics. Where in your body, what tests reveal the E. coli? And then what is it doing there? How did it get there? And is it having any negative effects on your overall health? And then back to that restrictive diet. What's being restricted and why is it being restricted? For instance, is it an anti-inflammatory diet? Because for eczema and a lot of skin conditions, that's actually proven to be very beneficial. Get rid of processed foods, red meats, processed sugars, processed carbohydrates. Those are all very inflammatory and can irritate skin conditions like eczema. I personally have rosacea, so I know as much as I love it, when I have a steak, the rare times that I do, my eczema flares up. If I eat a bag of Doritos or a lot of sugar, candies, it's the holidays, my rosacea acts up. So having a restrictive anti-inflammatory diet isn't bad. It's actually really good. But what are the exact restrictions that your doctor has recommended? It's important to know. Now, there's different ways in which functional doctors aim to reduce inflammation in the body, and this process can take time. So sit down, discuss with your doctor, and see what the goals are and what the expectations are. If your doctor expects that you need to do this for a few months before noticing a difference, maybe that'll help you feel better if you're not getting immediate results. I hope that helped answer your question. Okay, we're back in our HOV lane. Now, this Instagram question comes to us from Jamarcus. Greetings, Dr. Kaur. Greetings, Jamarcus. I just hit the big 6-0 and I'm still in pretty decent shape, but I just read an article that mentions something about difficulty absorbing nutrients and developing vitamin deficiencies as we age. Besides getting older, are there other things that can contribute to a vitamin deficiency? Hi, Jamarcus. Thank you for sending in your question. And it's a great one. And it just so happens that I have a list of lifestyle factors that can contribute to vitamin deficiencies, believe it or not. Now, some of these are listed on your screen. Let's go through them. Number 1, reduce sun exposure. So this can lead to low vitamin D levels. As we mentioned before, there is a certain amount of sun that is safe and recommended to get in order to have optimal vitamin D levels. It's not always possible, though. But it is something that we recommend. Now, sunscreen. Sunscreen is very important, so please make sure you're wearing sunscreen when you're out there. Let's get to number 2. Number 2 is poor nutrition. Now, a result of loss of appetite or limited food variety, usually it's the latter one, the limited food variety, can lead to reduced absorption and intake of a lot of vitamins and minerals. Eat the rainbow. So you want to eat things that are different colors, that are naturally produced. Remember, if Mother Earth didn't make it, try to avoid it. So lots of fruits and vegetables in different colors have different nutrients in them, and your body is used to absorbing those. But it's not always possible to get all those, right? And because of this limited food variety, we do end up having some nutrient deficiencies. Now let's talk about number 3. This is a very commonly seen one in primary care. Medications. Now, did you know that a lot of medications can actually inhibit the absorption of other vitamins and minerals? Some medications can actually interfere, like we talked earlier about NSAIDs and antacids, proton pump inhibitors, metformin. For instance, if I have a patient who's a diabetic or has been on metformin for many years, it's important that once a year they get their vitamin B12 levels checked, because people on long-term metformin can have vitamin B12 deficiencies. So lots of more examples like that, but that's all just to say that medications, even though they're wonderful and great for certain conditions, can have unintended side effects. So you really want to make sure that you and your doctor are on top of that. Now let's get to number 4, decrease stomach acid production. Now, too much stomach acid can obviously cause a problem, but not having enough can also cause a problem. So you really need to reach that fine balance. Now, this can lead to impairing nutrient absorption, just like we talked about earlier with iron. Let's get to number 5. Chronic illnesses. In this day and age, we have seen an increased incidence in a variety of chronic illnesses, unfortunately, and this happens for so many reasons. But not only is the illness something to deal with, but then you're also dealing with the fact that a lot of gastrointestinal, cardiovascular, and respiratory disorders can actually affect nutrient absorption. So you want to be mindful of that. Now, the other thing I want to also mention is that even though each of these fine detailed points that I just noted, we can have a whole episode on every single one of them. That's how much there is that goes into it. But I think it's important to note the basics, leading a healthy lifestyle. So eating a healthy diet, minimizing processed foods, minimizing alcohol, caffeine, risky substances, drugs, smoking, all of that. Exercising on a regular basis has so many benefits. Avoiding, things that can cause inflammation in your body, and reducing your stress and getting plenty of sleep is all very important and very, very highlighted lifestyle factors that are going to help get your nutrients and minerals. All right, friends, it looks like we have another question, and this comes from Facebook. Oh, it's from Darla. Darla asks, Dr. Kaur, I love my twin sister, Marla. My parents thought it would be cute if our names rhymed. Anyway, we're really close, but she's a little bit of a hypochondriac, and as a result, she goes a little overboard with the vitamins and supplements. We're taking over 20 pills a day. Is there a risk of taking too many or too much of a specific vitamin? Well, Darla, sister of Marla, I think that's very cute, by the way. Thank you for your question, and you are indeed correct. Too much of a good thing can be a bad thing, too. Now, that holds true for some vitamins and minerals as well. For instance, let's talk about vitamin A. Excessive intake of vitamin A can actually lead to toxicity, causing liver damage, bone loss, and vision problems. So although vitamin A is very important for certain functions of your body, it can lead to harmful effects if you're taking too much or if you have too much in your system. Now, vitamin D. We've talked a lot about vitamin D today and how important it is, but did you know that having too much vitamin D can lead to toxicity as well? This can lead to a harmful increase in calcium levels in your body. This can cause nausea and gastrointestinal discomfort, even kidney damage and heart problems. So you really want to make sure that if you're taking vitamin D, especially if you're taking it without knowing your baseline levels, you want to make sure you're not taking too much. Now, while there are some vitamins that if you take too much, it's really not going to harm you, for instance, vitamin B12, there are other vitamins, as the two that we just mentioned, that if you take too much can be very, very harmful. Another one is vitamin B6. Now, this can be toxic at high doses as well. And can cause symptoms such as dizziness, nerve damage, nerve pain, numbness, sensitivity to light, and issues with skin as well. So all that being said, please do get your vitamin and minerals checked with your doctor before you start supplementing, because you want to make sure you're doing it safely and you don't want to be harmed. Well, we have a really interesting question here from Facebook, and it comes from Colton. And Colton asks, Doc, I'm really embarrassed to be asking this question, but here goes. What vitamins exactly? Other than the fact that there's like vitamin A through vitamin Z, I have no idea what they do. Hi, Colton. There's no reason to be embarrassed. No question is too small or too strange or to be embarrassed about, because when it comes to your health, the more you know, the better it is. So I applaud you for reaching out and asking us this question. Basically, vitamins are micronutrients that the body needs in order to function at its best. They're essential for a lot of our body functions like growth, development, metabolism, immune system, creating blood cells. I mean, the list goes on. Now, because most vitamins are actually not made in our own bodies, they can't make them, we have to supplement them. And the best way to do this, like I've mentioned, is through a natural, healthy diet. But certain vitamins we just aren't getting enough of in our diet. And then that's when supplements and vitamin tablets or tinctures come into play. Now, the ones that our body make on their own are vitamin D3, K2, and B12. But you may even need supplements for these sometimes. So always talk to your physician about it. Now, there are certain situations in which a person might need a higher dose of certain vitamins than the average person would. For instance, if you're a pregnant woman, you might need higher doses of certain B vitamins. If you are somebody who drinks alcohol on a regular basis, because doing that will deplete you of certain vitamins, you might need to supplement those. And then if you have certain medical conditions, you want to make sure that your certain vitamin levels are optimized and at their full potential. Either way, it's best to check in with your PCP and see what is appropriate for your individual case because we all differ. We've got another question that comes into us from our website, allhealthtv.com. Now, if you haven't visited the website, I really encourage you to do so. It's chock full of a lot of great information, and then you can even connect with us through there. Let's see. This comes to us from Bridget, and Bridget asks, Dr. Kamaljit, my husband has a hard time taking pills, always has. However, that said, I know he's not getting all the vitamins and nutrients that he needs. So I've decided to take it upon myself and make sure he gets what he needs through the food we eat. Any suggestions? Hi, Bridget. Thank you for sharing your story. I've got a list of vitamin fortified foods for you. So let's go through them. Now, when it comes to vitamin D, you can find this in fatty fish like salmon and mackerel. And with salmon, be careful. You want to get the king salmon or the darker pink hued salmon, not the Atlantic salmon so much. It doesn't have as much of the good nutrients that we're looking for. Fortified dairy products, so like milk and yogurts, can also have vitamin D. And then, of course, there's sunlight exposure, which isn't a food, but it's still very important. The next one I want to talk about is vitamin B12. This can be found in a variety of meats like poultry, fish, in eggs, and fortified cereals as well. Then you got vitamin C. This can be found, and we all know this commonly, in citrus fruits, so like oranges, grapefruits. Then you have bell peppers, strawberries, and leafy greens also have a good amount of vitamin C. Vitamin A is our next one. Now, vitamin A can be found in carrots. We all know this, right? We get told that from our young age that eat enough carrots so you can have great vision so your vitamin D stays high. Sweet potatoes also have a good amount of vitamin D, as does spinach and kale. Then you have magnesium. Magnesium can be found in leafy greens, nuts, seeds, and whole grains. And then vitamin K, a very important vitamin, is found in leafy greens, broccoli, and certain fish. Now, I applaud and I love that you're taking the initiative to keep your husband happy. Sometimes we kind of have to interject and do these kind of things as wives, right? So kudos to you for that. As I've mentioned a few times now, because it's so important for everyone to know, a healthy diet is the best way to get your nutrients. Eat the rainbow. A variety of foods is going to give you all that you need. And remember, limit those processed foods that are inflammatory and can limit the absorption of all those nutrients. All right, it looks like we're going to take a little detour again. And the next question is from Elise. And this comes out to us from our website again, allhealthtv.com. Elise asks, Hi, Dr. K. My name is Elise. I've been having really bad eczema flare-ups lately, and I know sugar cravings and stress are a huge factor. But I was wondering if parasites also play a role as well. My mom is from South America, and they do parasite cleanses every 6 months to a year, but here in the US, they never do. Elise, that is a very interesting question. And it's interesting because I learned something today. I did not know that was a routine standard of care down in South America. Now, that being said, I often hear, especially in primary care, we often hear of a lot of diagnostics and treatments that occur in other parts of the world that we just don't do here in the US. And before I answer your question, I'd like to highlight that in the US, for the most part, physicians practice what is called evidence-based medicine. And this means that we have to have enough research and data behind something to support recommending it to our patients. Because our MO really is, we just want to do what's beneficial for the patient and minimize any harm to the patient. So similarly, now treatments like parasite cleanses, while some studies have linked that parasitic infections can increase your risk of eczema and other skin conditions, we just don't have enough data to validate it as a general statement to our patients. Now, all of that being said, reducing stress and laying off the processed foods, that can certainly reduce your eczema flare-ups. I know it does for my rosacea, as I mentioned earlier. So it definitely works. Also, please make sure to get your vitamin D checked because a deficiency in vitamin D has been linked to an increase in skin conditions. So something to make note of as well. All right, let's see here. We have a few more questions. Oh, it looks like this is all the time that we have for today, folks. I hope that the questions that we answered today had you thinking and have you a little bit more interested in about getting the vitamins that you need, the minerals that you need, and really living that healthy lifestyle. Remember, before you do anything, always talk to your primary care physician about your personal situation, your personal health risks, and what is most beneficial for you. Because the last thing we want you to do is take a bunch of over-the-counter things that are actually going to be harmful instead of beneficial. So that being said, thank you again for tuning in. I'll see you next week. Stay happy and healthy.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.